Okay, before entering a patient's room, I'm going to go ahead and check their chart. I'm going to make sure I collect all the supplies I need. In this case, with using the Metaneb or IPV, I'm going to go ahead and grab the machine itself. I'm going to grab any medications I might need with that, or just saline. I can use mucolytics, bronchodilators, any of that in the aerosol therapy with the Metaneb. And I'll also grab, if I need any adapted pieces, like a anesthesia mask or the trach adapter if I'm going to use it on a patient. I'll also make sure that I see if the patient is alert and oriented, and yeah. Okay, so then I'll enter the patient's room. I'll introduce myself. Hi, I'm Kate. I'm with respiratory therapy. It looks like today that the doctor has prescribed some bronchohydrating therapy that we're going to do. We're going to use this device called the Metaneb device. What it does, it's going to do some lung expansion, also help with that secretion clearance by having some oscillated positive pressure. And what it's going to do is hopefully with aerosol medication shake loose some of that mucus and secretions that you have and help you breathe easier. So today I'll just show you that all you're gonna have to do, it's about a 10-minute treatment that we're gonna do, and 8 to 10 minutes, and all you have to do is just breathe normally. But the most important part is here, you need to keep a tight mouth seal around this, okay? And it's gonna push you a little bit, it's gonna make you work, and that's okay, because you wanna get out of the hospital, and we wanna help you, we wanna push you and get you out of here as much as push you to get back to baseline, okay? So let me just explain here. The patient would go ahead, I'll set this up. These tubings would come separated. This just connects to the Metaneb. Go ahead and stick it in and twist. Now that's connected here. I can set this up, put all my tubings together, and then go ahead and hook up my Metaneb, the oxygen, to the wall outlet. I'll show you the parts here. The biggest part I'm going to be watching while I'm monitoring my patient is their pressure right here. We wanted a therapeutic pressure, so we wanted at least above 10 or 10 to 15, making sure we're making our patient work. We'll start them off on the aerosol therapy, administering the medication for 2.5 minutes. Then we'll go ahead and kick them up to the continuous high flow oscillation. With that, we can do different oscillations here, more rapid oscillation, or slow the pace down a little bit. Meanwhile, continue to monitor the patient's seal around the apparatus and also their pressures. And then we'll do that for 2.5 minutes. Go ahead and kick it down to continuous positive expiratory pressure, very similar to the Easy PAP. We're going to go ahead and, and I forgot, we can go ahead and monitor or increase the flow. Flow and lung pressure are directly related, so the more flow you have, the more pressure in the lungs we're going to create. So you can see on the pressure here what that will look like. So yeah, we end it with the continuous positive expiratory pressure, 2.5 minutes as well. And then that's it. We'll have the patient cough afterwards. They'll probably cough throughout it. And then we'll go ahead and listen to their lung sounds and see if our therapy was effective or not. If it was, you would hear a decrease in secretions. You can hear their work of breathing become a lot easier, and diminish crackles and things like that. And at the end of our treatment, we make sure that the patient is comfortable. If they need anything, make sure they have their call light and everything set up, and that's it. Oh, let's talk about some contraindications real quick. Contraindications of the Metaneb would be untreated pneumothorax, active TB, any facial trauma, ICP greater than 15. On a side note, if it was a treated pneumothorax, they were on a, if they had some chest tubes and it was hooked up to suction, we can go ahead and still use this. We will see some leakage through some bubbles in the water of the chest tube, and also it can increase sub-Q emphysema. So just to be aware of that. And that's it. Thanks.